Hi, my name is Margie Rodriguez, NP,
Eladia Lala Reyes sitting here.
Christy Alaman, DNP.
and we wanted to welcome you to our NP Table Talk. Today, I have a very interesting story that I would like to talk about. We had an incident at work a couple of weeks ago where my provider was called. It was actually a message left on the answering machine. And so the MA was listening to the messages, and she's like, "Oh my goodness, you need to listen to this." And it was a supposedly a DEA agent calling and saying that the provider was under investigation for medication for controlled substances. So we're like, that's kind of odd. But anyway, we took down the number. He went to another room and he called, and we were in the middle of clinic. So, and he did explain that to supposedly that DEA agent, and is like, okay, well then they set up a time for the following day at 4 p.m. So me and another provider who works there, we were just like, that just doesn't seem right, you know? So we started doing more research, and we kind of, in our back of our minds, we're like, we don't think that they called, but, we're not too sure. So we looked on the website. The number that he had given was almost identical to the number to the DEA on the website for their headquarters. So we're like, man, is this really legit? So we're like, you know what? Call them back and ask for a case number because we didn't get a case number, nothing. So we called back, same agent. And it's funny because the agent said he was Agent Morris. And then he had an Asian accent. We're like, God, that still doesn't seem right. But anyway, he gave a case number. So we were like, okay, ask for his supervisor. And he said, no, that cannot be given until tomorrow following the call. We're like, okay. So we went onto the website and we called the actual headquarters. And immediately they said that was a scam. Um,
There have been a lot of scams.
Yes, and it was like, thank goodness. And we asked, I was like, what did you give that man? He goes, I only gave him my phone number. And I was like, well, don't open any suspicious links or anything because that will immediately set off a virus or something. Because they're trying to get your information, personal information. So
Thank goodness you went with your gut, girl, because like for
yes, well,
real.
thank goodness for that other nurse practitioner also, and we're just like, no, we need to dig into this. So thank goodness so there is the website for the DEA where you can actually leave a tip because they'll follow it through as well. So for y'all out there, just know don't fall for those scams. And in fact, I was just looking at the DEA website, and as of February 21st, they've implemented a new security feature, which is called a multi-factor authentication, which is now being added to the registration validation tool set. So again, there's these scammers.
Be
out there.
mindful, yeah, because
Yes.
nobody ever wants to be on the naughty list for the DEA.
Correct.
Everybody is terrified of getting on that naughty list, and so for you to get a message and be like, "Oh my goodness, like I need to follow up. I don't want to delay it," but then to still say, "Hey, wait a second, it doesn't jive,"
Right.
and that's kudos to your team, like really, and that's a great story to actually talk about and start with because how many times do we get odd things in the mail or email and they're fishing for information
Correct.
and it's always being mindful because we have to protect those things because we all know we're in a narcotic epidemic, right?
Correct.
Yes. And so we have to be mindful going forward, and especially for scammers. I mean, like really, that's crazy. Thank you for sharing the story, Margie. Because
No, I thought, well, he was the one who actually said, I think you need to put that in the podcast. So I was like, okay, we'll do.
It's a good one.
It is a good story.
It's a good story.
It really, truly is, because he would have not known otherwise had we had not. He would have called that agent the next day, and who knows what they would have taken from him had he given them more information.
Yeah.
So
wow.
And our license numbers, you can actually find them online. Your NPI number is actually online. You can easily Google those. I think the one number that is not online anywhere that is more restricted to get access to is your DEA number.
Exactly, and I guess that's why they're fishing for it and just being mindful of those.
Because they already know your license number,
Yeah,
your NPI. That's the last
sure.
little bit of information they need.
And he was like, we know there's only certain computers that can send narcotics, to the pharmacy. Not everybody has access to that. There's only, maybe 2 computers in the office and then his at home. So he just was trying to go back and say, well, could it have been when he faxed to the nursing homes? Because those are the ones who you don't get to send electronically. They actually need them.
Wow.
So, but
it sounds like you have a good safeguards in place where you work, and that's awesome. Because again, you have to be mindful when you're prescribing narcotics, because you don't want to be a provider that ends up on that naughty list and flags the company. So checking things is always appropriate, right? When post-operatively, I'm sure you guys deal with this often, is that PNP website that a lot of us providers utilize, especially since we have more awareness nowadays regarding the narcotics, and making sure that people aren't getting medications at this office, that office, and everywhere else. And so I'm glad that we have those things in place.
I am so glad too, because we do offer pain medications, and I mean, rightfully so. Patients are coming in for acute and or chronic back issues, neck issues, whatever it may be, and we want to be safe when we prescribe. So that PMP is like, hey, you know what? I saw that you just were prescribed this medication by this doctor. Oh yeah, so it's a safety. I really like
doing your
that.
due diligence. I mean, I think it's not, I don't know, it's mandatory, but it's pretty much almost mandatory that we have to check PMP, and especially if it flags. So, like in the hospital, if I'm putting orders in, it will flag and say, "Did you check this?" And it's like, "Yes, I did verify," or "I verified through an external source." But you have to click that before it allows you to submit.
That's awesome. That's very, even at the hospital, that is a good flag, because sometimes you'll have patients who actually, I have a story where a patient actually was acting as though they had cancer in the hospital to get narcotics. So that's a good system.
And all these polypharmacies.
Exactly. And so, yeah, it did happen at the hospital like that. And we flagged it because I had seen the patient for the second time with the same kind of story, just so you know. And so people are very creative when they're looking and trying to get those drugs. So that actually makes me happy that they have that safeguard in place to say, hey, this person's flagging. Wow, that's awesome. So going back to that PNP website, if you're not checking the PNP website, I know NP Table Talk is like, check the PNP website, because you should be catching that as a provider for the wellness of your patient.
Right? And it's like, I think Texas Prescription Monitoring Program is what PNP stands for, if you don't know. So you can just Google Texas PNP and it'll take you. You do have to have access to the website. So I think you can delegate a nurse, and some specialists do that, but you as a provider, you should actually do it yourself and have your own password and everything that you can check.
And so that that not all NPs can prescribe narcotics, in certain situations or specialties, we're allowed to. I know in hospice, I was allowed to provide medication of Schedule 2s and 3s. Also in
and those are the 2 settings. Only hospital and inpatient hospital and hospice are the only situations that we can prescribe Schedule 2s. And Schedule 2s would be something like Norco now is a Schedule 2, Adderall, things like that. Tramadol is a Schedule 3. But
those are different medications that we definitely talk about, because nurse practitioners are in an array of settings, as we all know, and it does limit care at times. And I know we fight legislatively for those changes here in Texas specifically. Again, always being mindful in your scope of practice and making sure you're following the rules is always important. I know for us, it's always checking that PNP website on the outside. And again, it sounds like the inpatient side too, so that's amazing.
And another misnomer that I think some people think is, oh, I don't prescribe Schedule 2s, or I don't prescribe narcotics. I don't need a GA license. Yes, you do. You need a GA license to prescribe anything at all. Anything at all. So make sure you keep your DEA license up to date, and it's good for 2
good,
years.
Good advice there for sure.
Yes.
As CEUs have gone up, you need to get 8 hours of narcotics DEA stuff under your belt for renewal as well, because again, it's awareness of the epidemic and making sure we're following the guidelines and stay, if a patient can get off a narcotic, we try to find the means to get them off a narcotic. I know you deal a lot with that in your setting, Margie, and I know post-op when you're leaving the hospital, I'm sure that's difficult too, because you're trying to, it's pain medication, right?
Yeah, but the specialists usually order those.
And that's good to have them ready to go. So that's awesome. And what else do y'all have on the narcotic aspect? I know even in like our outpatient settings, testosterone is a controlled substance. And so that's also registered with the DEA, and you have to be checking that. I don't know if people are aware of that as well. And you need to make sure you're writing that appropriately as well.
Yeah, I didn't know that.
That's for the pellet therapy that people get as well.
Oh.
Yeah. That it's just fun facts that we have right here, but that's definitely something that it's incorporated into the DEA conversation.
Right.
Always get a urine.
Yes, UDSs.
Get a UDS. And then if you really are still questioning, like if this patient is, getting urine from somewhere else, you can always, there's blood tests that you can do so that you can specifically check for levels in their blood to see like, oh, well, are they even taking it, or did they take one so they would show positive so that they can get the refill, those things like that.
Oh yeah, that's for sure. Like they know when it's going to be out of their system and they want that bottle. Because sometimes those people are selling those narcotics, and you have to be mindful. It's silly to think about that, because if you're following the rules, that's not something that really crosses your mind. However, sometimes you have to be like, like I know in the outpatient setting, when I was prescribing narcotics, it was kind of like, oh, you're, Mr. So-and-so, they're about 65, they have chronic osteoarthritis. And then you're just like, okay, are you having any pain? No, I don't have any pain. Do you take anything for pain? No. You're looking at the med rec. They have tramadol or Tylenol number 3. Well, then daughter comes in the room and they're like, hey, did you get that refill for the tramadol? He's in a lot of pain. And then you're like, I just spoke to him and he just told me he doesn't need anything for pain. So you have to have those difficult conversations in those rooms sometimes. But I know other people probably have run across this.
But that's why you do a urine. You actually want them to be positive, because if they're not positive, you're like, well, you get 90 pills a month and
you're clean.
You tomorrow and you're negative. So,
and that's one thing we do where I work. We check UDSs on all our patients.
That's it.
And especially those that we are giving pain medications to, those chronic patients. We check to be sure, because we have come across where they're negative, and it's like, you've had this medication, so what's going on? And that's where you're like, hey, you know what? We're gonna have to cut you down now. And they're like, they fumble, but it's like, I'm sorry, but
And you're always just doing right by the patient when you're having those difficult conversations as well.
And always, do an assessment too, because, sometimes they might be in pain. Maybe they look like a drug seeker. I don't know. But you do have patients that are legitimately in pain and
100.
that do need the medication. So we're not saying you don't give pain medication. We're just saying be safe about it and make sure you're crossing your, T's and dotting your I's.
100%. And like I said, that's something I don't do in my practice. If someone needs pain medications, I usually give them to a specialist and make sure that they're followed up appropriately, so that we are investigating different avenues for treatment, of course. But sometimes it's like Christy said, this person has chronic pain and they do need it. And after you've checked all those boxes, that's when those things make sense, and doing your due diligence as a provider is necessary.
Or have they had a good workup done for, say, this back pain that they've had? So I had this in the clinic one time, severe back pain, severe low back pain, right? They go to the clinic, they give him Toradol shots. And then I'm like, have they even done an x-ray? This is just, about every, 4 months or so, he'd come in and say back pain. I did a workup, right? Started with an x-ray, which led to an MRI, and it was cancer that had already metastasized to his back. So make sure you're just, doing a thorough workup on your patient, not just given them the pill, but like, did you actually assess to see if there's something wrong? And it's always a lie.
No,
why
are they having pain? Exactly. Always investigate those things, because it's like you said, you can find cancer. Is it something else that can be resolved? And doing that due diligence, once again, as a provider, is what's best for that patient, because the patient just thinks they have OA, and so it's sometimes, no, it's something bigger and needs more attention right away versus it's just, they're old and they need a tramadol or whatever. But because it does happen sometimes, you get older and the Tylenol's not working, ibuprofen's not working, and that's okay. But you've already, like you said, done due diligence and work that patient up appropriately. And that's always good, for sure.
So just a reminder, circling back to the DEA, know that they will never call you, okay? They will actually email you or send you a letter, but they do not call. So don't fall for the scammers. And if you do, please go to the website and report it.
Yeah. All right. I think that was great. Good job, ladies.
All right. Well, thank you all for listening. So follow us on YouTube, NP Table Talk. We have Spotify for podcasters, Podbean, Facebook, or you can email us. It's all NP Table Talk. All right. We'll see you next time.
Thank you.
Bye.